If you're receiving Social Security SSDI or SSI right now, or you know someone who is, there's a change in your monthly payment that took effect this year, and a lot of people still don't fully understand what they're actually receiving. Today, we're going to walk through the real numbers, not the headline number that made the announcement sound bigger than it is, but what's actually landing in people's bank accounts after all the adjustments. Because here's the thing, the government announced an increase. And that's true. But there's another number, one that got a lot less attention, that took a sizable bite out of that raise before most people ever saw it. We're going to cover what the new payment amounts are, who gets what, when the money started, and what that Medicare situation actually means for your bottom line. So let's get into it. Every year, the Social Security Administration adjusts benefit payments to try to keep pace with inflation. That adjustment is called the Cost of Living Adjustment, or COLA, and it's calculated based on a specific inflation index called the Consumer Price Index for urban wage earners and clerical workers, or CPI-W. The idea behind it is straightforward enough. Prices go up over time, so benefits need to go up too, otherwise people slowly lose ground. If your groceries cost more, your utility bills are higher, and everything from a doctor's visit to a gallon of gas costs more than it did last year, then a fixed monthly payment buys you less and less. The COLA is Social Security's answer to that problem. Now, the size of the COLA changes from year to year depending on how much inflation ran during a specific 3-month window, July, August, and September of the previous year. If inflation was high during that period, the COLA will be higher. If prices were relatively stable, the adjustment will be smaller. For 2025, the COLA came in at 2.5%. That was a step down from the unusually large increases of the prior 2 years when inflation was running hot and COLAs were hitting 5, 6, and even 8%. For 2026, the Social Security Administration announced a 2.8% COLA, slightly higher than 2025, reflecting the fact that inflation ticked up a bit. The Consumer Price Index was running at about 3% annually when the announcement was made in October 2025. That number, 2.8%, is the headline figure you've probably heard. But let's talk about what it actually means in dollars. The average monthly Social Security retirement payment was around $2,008 to $2,015 in 2025. With the 2.8% COLA applied, that average has moved up to roughly $2,064 to $2,071 per month starting in January 2026. That's an increase of about $56 per month, or roughly $672 over the course of a full year. If your benefit was on the lower end, say $1,500 a month, your increase would be about $42. If you were receiving $1,800, you're looking at around $50 more. And if you were closer to the average, somewhere around $2,000, you're seeing that $56 figure. SSDI, Social Security Disability Insurance. For people receiving SSDI, the same 2.8% COLA applies. But since SSDI payments are calculated based on your work and earnings history rather than a standard amount, the numbers vary more from person to person. The average SSDI monthly payment in 2025 was approximately $1,586. With the 2026 COLA, that average has moved up to around $1,630 per month. That's an increase of about $44 per month on average. The maximum monthly SSDI benefit has also increased from $4,018 in 2025 to $4,152 in 2026. Most people don't receive that maximum amount, but it gives you a sense of the upper range. Your individual SSDI increase depends on your specific benefit level. Take your current monthly payment and multiply it by 0.028. That gives you your monthly raise. So if you're getting $1,200 per month, your increase is about $34. At $1,800 per month, it's about $50. SSI, Supplemental Security Income SSI, is different from Social Security Retirement and SSDI. It's a needs-based program for people with very low income and limited resources, including people who are elderly or disabled. For SSI, the maximum federal monthly payment for an individual has gone from $967 in 2025 to $994 in 2026. That's an increase of $27 per month. For couples where both partners receive SSI, the maximum has gone from $1,450 to $1,491, an increase of $41 per month. SSI recipients also got their increase a day earlier than everyone else. Because January 1st, 2026 falls on a Wednesday, SSI payments went out on December 31st, 2025 instead. Here's where the timing breaks down by program. Social Security retirement beneficiaries started seeing the higher payments in January 2026. Your payment date depends on your birthday. Some people get paid on the second Wednesday of the month, some the third, some the fourth. But regardless of which Wednesday your check arrives, the increased amount started with the January payment. SSDI recipients also began receiving the higher amount in January 2026, following the same payment schedule. SSI recipients received their first increased payment on December 31st, 2025, as mentioned above. If you're not sure whether your payment reflects the new amount, the easiest way to check is through your personal My Social Security account at ssa.gov. You can log in there and view your current benefit amount as well as your COLA notice, which was sent out in late November and December 2025. Now here's the part of the story that didn't get as much attention, but it matters a lot for people who have Medicare Part B coverage and receive Social Security. Medicare Part B covers outpatient services, things like doctor visits, lab work, and preventive care. For most people on Medicare, the Part B premium is automatically deducted from their Social Security check each month. You don't write a separate check. It just comes out before you receive your payment. In 2025, the standard Medicare Part B premium was $185 per month. For 2026, that premium increased to $202.90, a jump of $17.90 per month. That's a 9.7% increase. Let's put that side by side with the COLA. Social Security benefits went up 2.8%. Medicare Part B went up 9.7%. The Medicare premium increase is rising roughly 3.5 times faster than your Social Security benefit. In dollar terms, the average Social Security retirement recipient gained about $56 per month from the COLA, but $17.90 of that came back out in the form of a higher Medicare premium. So, the net gain, what actually hits your bank account, is closer to $38 per month for the average retiree on Medicare. For SSDI recipients, the situation is similar if they're enrolled in Medicare. The average SSDI increase was around $44 per month, but after the $17.90 Medicare premium hike, the effective take-home increase is roughly $26 per month. Policy analysts have pointed out that this is now the third consecutive year that Medicare Part B premiums have grown faster than the Social Security COLA. The Senior Citizens League, which tracks this closely, has noted that the pattern steadily erodes the real purchasing power of benefits over time, even when a COLA is announced. One independent analyst put it plainly, Part B premiums rose nearly 3.5 times faster than the COLA this year. That's a real squeeze for people on fixed incomes. There's one important protection you should know about, called the hold harmless provision. Under federal law, the Part B premium increase cannot cause your net Social Security check to be lower than it was the year before. If your COLA increase is smaller, in dollar terms, than the Part B premium increase, the premium is capped so that you don't end up with less money than last year. In practical terms, if your SSDI or Social Security benefit is small enough that a $17.90 Medicare premium hike would wipe out your entire COLA gain and then some, the law protects you. Your Part B premium will be raised only up to the amount of your dollar increase, not beyond it. One analysis found that beneficiaries receiving a Social Security payment of $640 or less per month are among those most likely to have this provision apply to them, since $17.90 represents a larger share of a smaller COLA increase on a smaller benefit. It's also worth noting that this protection applies to people who have their Part B premiums deducted directly from Social Security, not those who pay their premiums separately. And it doesn't apply to people who are newly enrolling in Medicare Part B in 2026, since there's no prior year benchmark to compare against. Let's put some real scenarios together so this isn't just abstract numbers. Imagine you're a retired woman in her early 70s. Her Social Security retirement check was $1,800 per month in 2025. With the 2.8% COLA, she gets an additional $50.40 per month. But her Medicare Part B premium went up by $17.90. So her actual net gain is about $32.50 per month. Now take a man in his late 50s on SSDI. His benefit is $1,400 per month. His 2.8% COLA adds $39.20. If he's on Medicare, which many SSDI recipients become eligible for after 24 months of receiving benefits, the $17.90 premium increase brings his real-world gain down to about $21 per month. And for an SSI recipient receiving the maximum individual amount, the increase is $27 per month. SSI recipients do not typically have Medicare Part B deducted from their SSI payments in the same way, though rules vary depending on individual circumstances, so the picture may be different for each person. These aren't small distinctions. For someone living on a fixed income, the difference between a $56 raise and a $32 raise, or a $44 raise and a $26 raise, matters when you're making decisions about groceries, prescriptions, or whether you can afford to turn on the heat. It's worth stepping back for a moment and looking at where this year fits in a longer trend. The 5-year COLA average from 2022 through 2026 works out to about 4.6% annually, which is well above the long-term historical average. That stretch included the 8.7% COLA in 2023, which was the largest in 4 decades and came during a period when inflation was running very high. So in that sense, 2026's 2.8% is a return towards something more normal, following a period of unusually high adjustments. But here's the part that advocates for older Americans keep raising. Even during the years when COLAs were large, the underlying formula doesn't necessarily capture the expenses that matter most to older people. The CPI-W, the index used to calculate COLA, tracks the spending patterns of working-age adults, not retirees. Older Americans, on average, spend a larger share of their income on healthcare and housing than younger workers do. So when healthcare costs rise faster than general consumer prices, as they have consistently for years, the COLA may still leave seniors behind in real terms, even when it appears on paper to be a meaningful increase. Some legislators and advocacy groups have pushed for using a different index called the CPI-E, which is designed specifically to track the spending patterns of people 62 and older. That proposal has been debated for years, but hasn't been enacted into law. If you're receiving any of these benefits, here are a few practical things worth doing. First, log into your My Social Security account at ssa.gov. You can see exactly what your benefit amount is for 2026 and verify that the increase has been applied correctly. If you haven't set up an account yet, it's free and it's the fastest way to get accurate information about your specific payment. Second, review your Medicare situation. If you're enrolled in Part B, make sure you understand what you're now paying. The standard premium is $202.90, but if your income is above certain thresholds, about $109,000 or more for an individual filer, you may be paying more due to income-related adjustments known as IRMAA. Third, if you're on a tight budget and you're not sure whether you qualify for programs that help with Medicare costs, it's worth looking into. Programs like Medicare savings programs and extra help for prescription drug costs exist specifically for people with lower incomes, and not everyone who qualifies is enrolled. Finally, be cautious about anyone who contacts you claiming to help you get a larger benefit increase, asks for fees to process your COLA adjustment, or says you need to provide personal information to receive your new payment. The Social Security Administration does not work that way. Your COLA increase is automatic. No one legitimate will ever charge you for it or ask for your bank details to apply it. Here's a clean summary of what's happening with payments in 2026. Social Security retirement benefits increased by 2.8%, adding roughly $56 per month to the average retirement check. SSDI benefits also increased by 2.8%, adding about $44 per month to the average disability payment. SSI individual maximum payments went up by $27 per month to $994. The SSI couple maximum went up by $41 to $1,491. At the same time, Medicare Part B premiums increased by $17.90 per month, bringing the standard premium to $202.90. For most Medicare enrollees who have their premium deducted from Social Security, this means the effective net increase in take-home pay is roughly $38 per month for average retirement recipients, and about $26 per month for average SSDI recipients. That's the honest picture. Not every headline gave you both sides of it. Social Security and SSDI benefits are genuinely important lifelines for tens of millions of Americans. Understanding exactly what you're receiving and what's coming out puts you in a better position to budget, plan, and make the most of what you have. We'll keep following this topic because the numbers change every year, and every year there's something in the fine print worth paying attention to. If you found this helpful, share it with someone you know who's on Social Security or SSDI, especially if they haven't looked at their new payment amount yet. A lot of people just see the deposit and don't think twice about whether it's correct. Thanks for watching. We'll see you in the next one.